Hi, I'm Andrew Graham, President and CEO of Clinic Service. Today I'm joined by Dr. Omar Mubarak with Vascular Institute of the Rockies. We're going to talk about ways that he and his partners effectively run a very strong practice. Good. Dr. Mubarak, you were born and raised in Denver.
Yes.
What attracted you to practice medicine here in your hometown?
Actually, my dad was a thoracic surgeon here, and I knew from the moment that I started trying to become a physician that whatever I was going to do, I would probably return back to Denver. I love the Denver area. I think it's the best place in the country to live. I've lived on the West Coast and the East Coast, and I love the lifestyle, the way people are very athletic, outgoing, and the climate, you just can't beat it. So I just wanted to come back.
Excellent. Excellent. When you did your residency, you went off to Michigan, and then you came back here to Colorado. In that residency, there was a lot of mentoring, a lot of coaching, a lot of time spent on your personal development. But then when you got into the personal world, I'd imagine that you had to go seek that for yourself. How do you and your other partners mentor and coach each other to keep your medical skills as top as they can be?
Sure. So we're a group of 5 board-certified vascular surgeons with a huge age in the group, meaning we have partners who are in their 60s, and then we have partners like myself, who I'm the youngest partner actually, and we mentor each other in many different ways because of the change in vascular surgery. So for example, in my training we learn more endovascular. So we learned about angioplasty, stents, arteriograms, endografts, DVT lysis. Whereas in, for example, my oldest partner's training, he learned more about thoracoabdominals, open aortic surgery, and thoracic outlet surgery. So I mentor him on endovascular type of surgeries, and he might mentor me on thoracic outlet syndrome, which is actually one of his favorite niches. And another partner who may have a niche in open thoracic surgery may mentor me on that while I mentor him on endovascular. And I think that's actually one of the strongest points about the group, is that each person within the group has a particular area in which they are super strong, but each surgeon actually does all of the gamut of vascular surgery. And so there's no reason why, if I was doing a thoracic outlet case, I wouldn't ask for Steve Annis to come along with me. Just like if he is going to do a complicated endovascular stenting procedure, he would definitely say, I need Omar to come with me to this case. And I think that brings the brightest and the best of vascular surgery to the Denver metro area. And I've always kind of stressed that to the hospitals, that I think that kind of a system is really the future of medicine in the Denver area. Because you always have the competition of, well, a newly trained person who's learned some new form of technology and he's coming out of training could easily go to a Michigan or a Texas and get paid more than he would in the Denver metro area. But it's always been my emphasis that that may be true, but if we bring in a new person, we will mentor each other, and it will enhance the development of that individual. Another huge factor for the practice is actually that we teach residents at St. Joseph's Hospital, and we also teach residents at PSL. And so it always keeps you up to date on the newest kind of things that are out there. But that's a lot of how we handle the mentoring as far as medicine goes.
There's a lot of talk in medicine right now about teamwork, collaboration, accountable care organizations. In your last response, you talked a lot about ways that you work together. What are some best practices that you guys do to make sure that teamwork and collaboration is being done to the fullest extent?
Sure. It is exactly kind of what I was stating, that if there is a case that involves one arena of vascular surgery, we really try to make sure that the person who's best at that is in on that case. Now, they may not be the consulting surgeon, so it wouldn't be uncommon for me to get a consult on thoracic outlet syndrome, but I would probably say, if I'm going to go to the surgery, I need Steve Annis to be with me at that surgery. And that ensures good outcomes. And if Steve Annis is going to go do some sort of complicated endovascular procedure, he will usually put me on the case too and say, it's going to ensure a better outcome, and that's why I want that person there. That, and then we meet at least once a week and go over most of the difficult cases that the group encounters. And that forum, along with M&M type forums in both hospitals, really ensure that you're getting the breadth of opinion of not only us, meaning us 5 board-certified vascular surgeons, but often to those conferences, radiology and cardiology appear. And so everybody puts in their 2 cents for a patient, and that's the way in which you get great outcomes for your patients, I believe, is those kinds of checks and balances.
One of the challenges that we find many doctors have is running a small business versus being a doctor.
Yeah.
They are 2 uniquely different disciplines.
They are.
What are things that you do within your practice to balance that small business versus medical?
Sure. So me, my father and I worked in the Denver metro area for a long time. My dad was a thoracic surgeon, but he was actually a businessman before that. He ran a carpet store, importing Persian rugs and selling them in the Denver metro area. Then he decided to go to college and medical school. He kept that business. He still owns that building on Colfax. And then slowly but surely over several years he bought several other buildings, and I've helped him run and manage those buildings. So in our group, the way that we've kind of tried to make the business stronger, and this has actually been kind of a recent phenomenon, is we as docs believe that if you don't have skin in the game, meaning you're not actually the working part of this machine, maybe you shouldn't be running it. So really the docs run it now. So myself and Dr. Nowak spend a fair amount of our time every week going through every parts of this business now. And I really think that the training that I received from my father was amazing. I just didn't know it at the time. Helping him to manage those buildings, dealing with snow removal, to leaks in the roof, to tenants who are trying to argue over their contract, really helped me substantially to gain a footing in kind of the business world that then has transitioned to this world. And I think it is better that the docs actually have an active role. It's very time consuming. And always doctors will say, well, it would be easier if I just deal with the world of medicine and push my business into somebody else's hands. But no one will run the business as good as you do. I firmly believe that. So somebody in your business who is one of the physicians, it's my feeling, should at least have a good handle on payroll, billing, doing at least yearly, if not quarterly, evaluations of the employees and making sure that they're reaching their maximum potential and that what you're paying for is actually worth it. But that's a definite challenge for all doctors, I believe. I also think on the reverse end, hospitals are just as challenged too. While they have a armada of business majors, their actual understanding of the medical terminology and what is really needed as opposed to what might just be sexy is a big challenge. And I think that's why they're hiring CMOs at many of the facilities now, is because they have this chief medical officer who can translate.
Be the liaison between
translate between business and the doctors.
Excellent. What are some of the challenges? You mentioned your people. Culture is what really runs a good organization, and creating an environment that people can perform and excel in. What are some of the things that you do here to sort of incent your staff to perform at the highest level?
For us, I'd say in the last year or so, when we really started to take over the business, it was more, sad to say, looking and saying, well, what employee is actually lazy possibly, or not really working that hard, and what employee gets kind of the team spirit. And then after we kind of got rid of some of the people who were clearly just not meeting their expectations, and then you have a core team, it's really just team building to me. You start to say, well, look, if it all functions better and we all are more productive, you take home more money too. So you just need to be more productive. And when everybody on the team is on the same page, and they realize that their bonus is necessarily tied to the productivity of the entire company, I think that helps substantially. And so since about a year, we've been just really trying team building and getting everybody to understand that their future, their hopes of raises on a maybe biannual basis or something is tied to the fact that the whole place must be productive. Yeah.
Excellent. So even with a strong culture, without cash flow, there isn't much of a business.
No.
And so what are some, you've had challenges in the past and you've had successes.
Yeah.
What are some challenges or things that you would advise other docs to look out for in cash flow? And then what are some steps that you've taken to improve your cash flow?
I would, I think that there's been a trend over the past couple years for doctors to say, well, insurers are simply not paying as much as they used to pay. And so the fact that my cash flow is somewhat diminishing, I kind of expect. I don't think that that's necessarily a positive thought to have in a doc's head. I think if the doc starts to notice trends like that, they really ought to look at their billing department quite heavily. It is, and you and I have talked about this privately before this interview, it's hard to say, well, Mildred, who's running billing in our place and has done it for 8 years, is doing a bad job, because you don't want to confront that person, and overall physicians are very nice. They're not confrontational by nature. They're just trying to help. And I think you do actually have to take a look at your billing, see how it's going, and if you're noticing trends that you're just not doing as well as you should be doing, you need to question that pretty heavily.
You've made a transition from in-house billing to outsourced billing. What has been the biggest advantage of outsourcing your billing?
I would say much clearer reporting, much more obvious as to what is occurring, better ability to track trends and see how you can improve, and eventually improve your cash flow.
Okay.
Yeah.
Good. If you were to advise a group of residents, you mentioned that you do work with residents. If you were to advise a group of residents today, here's the top 3 things any new doctor entering the medical field needs to know, what would those be?
First and foremost, you've got to stay on top of your medical practice, actually. Stay up to date, make sure you're doing your CME, and that way you stay certified and current, and you're doing the best that you can for your patients. Next, I would say you probably need to really know exactly what you're entering to in your business. So if you're going to go into private practice, you really ought to make sure that that is a stable, strong company that you want to, tie yourself to. And then I would also really look at the hospitals you're going to work in and make sure that they have the equipment and the highest level of technology and backup support that is available. And that would also kind of apply for your group, to make sure that you have decent people within the group who are going to help you to basically get your career going and keep it strong. Because I think it is a hugely important decision when you come out of residency and you choose your job. And actually, if you look, surgeons, I think like a third of surgeons relocate within the first 5 years of starting a job. Yeah. And it really shouldn't be that way. I think what makes them end up relocating is a weakness in one of the areas I just outlined, other than the CME. So the reason why I said, keep current, keep studying, make sure you're strong in your field, is because I'd say if something does happen and you do need to transition or move to another area because you were dissatisfied with your employer or dissatisfied with the job you took, you need to make sure that you're strong enough mentally and in your field that you've developed and stayed current. So that's foremost, the most important thing. But the other two, knowing that the business that you're entering is strong and kind of an idea of where it's going for the next 5 years, that would probably ensure that you actually get to stay there as opposed to moving, because it's costly. You know, it's not easy to pick up your whole life, especially if you have a family and kids. And then knowing that the hospital where you're at is vested in you and that they have all the backup and the support in your field is key, because, you know, like I was talking to you before about our group. Let's say I'm going to do some huge case that's a thoracoabdominal aneurysm. There would be no reason for me not to ask for Dr. Kramer or Dr. Annis to come with me, because that's a huge surgical procedure. It's like the biggest surgery you can do to a man other than maybe a Whipple. And you really, if you're right out of training, you want to have the support around you to pull off those kinds of surgeries and do them successfully and without complications. You don't want to be, you know, year one having huge complications or issues. So I would say those things are the three most important things for a surgeon who's at least starting out to consider.
Sure. Keeping up with the medical, I'm sure, is a full-time job. And
It
then
is.
there is industry changes and government
Yeah.
changes and regulatory changes and financial and compensation changes. What steps do you do to stay current with all of the more macro influences on those?
That is really hard. Trying to stay in touch with how they're changing billing all the time, that is never going to be easy. What we usually try to do is every year or so I try to go to the cath labs in each hospital and get them to sponsor some sort of doctor-related event, because it behooves the hospital to also be effective at coding.
Mm-hmm.
So, meaning our coding should match what the techs code in like a cath procedure, just as they should in the OR. The OR billing and coding isn't as big a deal, but coding inside the cath lab is, and it alters a lot, and it's very, very specific. And so, staying current with that, I usually try to get the hospital to sponsor some sort of billing and coding thing, you know, once a year, so that we go to it and they sponsor it for their own techs, so that their techs coding matches our coding. But we get to learn from it also. And most of the societies also, so like, you know, the American College of Surgeons and SVS, usually at their annual meetings they have a billing and coding lecture that you can get CME for, and it is the most highly sought after lecture every year. Usually it's hilarious. Like, that is the one lecture that will always be overbooked.
Sure.
In the societies. And so I try to go to those too if I can.
How have you been able to draw on your outsourced biller at clinic service to make sure that you are coding, you are capturing your information, and then those reports come back to you as effectively?
So at clinic services, they actually have a team of coders for us, and they have two particular coders who we talk to all the time. So, and we communicate via email a lot, or we just call them, frankly, if we're confused. And they've been very helpful to just sit and answer it. Now, I have to admit, you know, clinic services figuring out whether, you know, every surgical subspecialty is a little bit different from another, and it's hard for them to immediately take on a totally new surgical line that they haven't seen, but they're actually very good at it. And so in terms of vascular surgery, we have been learning with our two coders, you know, trying to keep as current as humanly possible with the coding, but they've done a very good job, and if they don't know the answer, they'll just frankly tell you, I don't know today, but we'll figure it out in the next 24 hours and I'll have an answer for you.